Talk Ultra.
In this week's Talk Training, we've got Trevor Pryor. Trevor is a specialist on feet and biomechanics, and many of you have asked in recent episodes of Talk Ultra and on Facebook and in email, could we discuss feet and some of the hints and tips, and Trevor's here to give you a real insight into what are the pros and cons of treatment for your feet, things to look out for, and how to make sure that you stay healthy.
You're listening to the latest training tips from Talk Training.
On this week's Talk Training, I'm talking to Trevor Pryor. Now, Trevor is a specialist in feet, and we've had a lot of requests about hints and tips for looking after runners' feet. So we have Trevor on the show. Trevor, welcome.
Thanks very much.
Before we get into the literally nitty-gritty, do you want to give us a little bit of an insight and a background as to who you are and what it is that you do?
Yeah, no problems. I'm a consultant podiatric surgeon. I've been qualified for 30 years, and virtually all my work is either foot surgery or gait analysis, sports injuries. I've worked with a whole range of professional and elite sports over the years, and also been involved in the design of bespoke footwear. So I'm trying to actually make the shoe that controls the foot in the right way. Privately, I work, I'm the director for Podiatry Limited, based in central London and the Essex area. And I'm involved in a lot of 3D gait analysis and advice to some of the running shoe companies.
Okay, so that puts us in a perfect situation to look at the issues and the problems that as a runner we can encounter. First of all, what tends to be the biggest problem and the thing that you see the most of?
Probably the most common foot complaint that we see would be something called plantar fasciitis, which is heel pain. So classically, someone would have pain on the underneath of the heel. Initially, it may just come on as a slight ache. It gradually becomes worse. It'd be present first thing in the morning, and it can get to the stage where people simply can't walk, let alone run. And that's probably the most common complaint. Although obviously we see a whole range of things that range from the foot to the knee to the hip and the lower back.
Now, plantar's one of those classic injuries that, you know, you either know somebody who's got it or somebody who's about to get it. It's a really, really common injury, and it can be something that can take quite a while to get rid of. Hints and tips for people who've got plantar.
Well, the first thing is, like with most injuries, don't ignore it. I mean, I see people who have had it for 4 to 6 weeks or 4 years. And even when I see patients now, I say to them, if you do everything I tell you to, it may take 6 months to settle. And the problem really is that people just ignore it for too long. It's a little niggle, it'll go, I'll just ignore it, but it gets worse. For me, for instance, I had some symptoms once a number of years ago. I noticed it on a short run that I did, went away, it was fine. I woke up the next morning and it was very slightly tender. Straight away, there was no way I was going to develop plantar fasciitis. So I implemented some fairly standard treatment strategies, which we can discuss, and rested for about a week and a half and never had another problem. My wife, by contrast, developed plantar fasciitis, didn't really do what I told her, and it dragged on for 6 months. So the secret with most conditions is treat them early.
And what normally causes this, Trevor? Is it ill-fitting run shoes?
Well, yes and no. We'll discuss running shoes and size and fit because that's key, but most people, if they've got a poor-fitting shoe, have had it for a period of time. And I think really it's a multifactorial condition, and there could be a whole range of things that can be the cause for it. So it may well be, you'll be familiar with the term pronation. Somebody could have a pronated foot type that places too much stress on the fascia. But we see it with people who have got a higher arch foot type, more of a supinated foot type, and that may just be because it's unforgiving. In a lot of instances, it can be down to inflexibility of the calf muscles. Somebody could have a little bit of irritation in their lower back, which causes a bit of nerve irritation. That nerve irritation causes a bit of muscle inflexibility. It changes the gait. Someone could go for a different run. They suddenly increase their mileage. They do more hill running. they're in the gym and they just run uphill on the treadmill to get more VO2 loading out of it. There's a whole range of things that can cause it. And it's usually just something that kind of, is that final straw, the straw that broke the camel's back, and then they develop the symptoms. And the real secret, I can't emphasize it enough, if you start to develop some symptoms underneath your heel, do not ignore it. If you treat it quickly, then it's a lot easier to manage.
It's the treatment thing that many people will now be interested in. Of course, some rest, some ice, some stretching and support are the initial things. What would you advise?
Exactly that. I mean, the very first things that you should be doing is say, right, okay, I just need to ease back a bit. I need to stretch my calf muscles. You can get some very good stretches off the internet these days. There are some stretches you could do specifically for the fascia. Icing the area, so a bottle of water frozen with a small tea towel and massaging your heel over it for 5 minutes. And looking at your footwear on a day-to-day basis. So a lot of people will work in the city and have either relatively hard-soled shoes, maybe a little tight if it's a lady, it may be flat, low, unsupportive. Start using your trainers to get to and from work so that you'll get it as cushioned as possible for as much of the time. And then when you get to work, change that. Keen runners probably already know what their foot type is like, so hopefully they would be in the right type of shoe. But if you're newer to running and you've never really had your running style analysed properly, then it's worth getting that done either at a specialist shop or going to see someone that specialises in running. Sometimes some support in the shoe in the short term can be beneficial just to try and rest the fascia. I think then if you implement those and it's not settling down fairly quickly, within a week, certainly 2 weeks, then a specialist opinion would be appropriate. We, for instance, would teach our patients how to strap the foot, which tends to have a double effect of reducing the tension on the fascia but keeping the natural fat underneath the heel to give a little bit of extra cushioning. Obviously, we would then analyse someone's shoes, make sure they're correct size, correct style, and think about specific orthotic modifications if they're indicated. And clearly, there's also that need to identify why someone may have some extra load through the foot. So while someone may pronate, people pronate for a reason. Pronation itself is not the problem. It's why do you pronate? Do you pronate because you've got a poor foot function? Do you pronate because your calf muscle's tight or you have poor control of your hip? So the secret then is to find out why you've got that dysfunction and therefore what can be done to help improve overall loading.
Sounds great advice. Now, you mentioned shoes. It's an area that can cause so many problems. And of course, there are so many varied opinions. I'm going to go with two opinions to start with. The first one will be the current trend and the current interest in minimalist or barefoot running. Is that something that is good if done sensibly and carefully?
Well, I think you have to differentiate between minimalist and barefoot because they are essentially different. Clearly, if we start with barefoot running, the whole tenet behind it really is a completely different loading structure. So instead of going heel-toe, you're effectively landing on the ball of the foot. And if you're going to do true barefoot running, the shoes that are designed for that are literally designed so that it's quite uncomfortable to run on your heel. Therefore, it keeps the weight onto the ball of the foot. Now, if you ask me how many runners do you see with a problem from barefoot versus for a more traditional heel strike, I see far more from the former. But that's because people have been running with that style for decades, and there are literally millions of people that do it. Therefore, the number of people that run barefoot are far fewer. It's minimal compared to the traditional styles, and for far shorter. But what we see is that not that you don't get injuries, you get different injuries. So we may be seeing more stress fractures of the metatarsals, more Achilles stroke calf problems.
Yeah.
If you wish to transition to a barefoot style, it is absolutely key that that you do a very specific training program for it, and you have to transition over a period of time. And some people, it can take 6 to 12 months plus. If you just go out and run barefoot, you're asking for trouble.
So the people who, follow the fads, follow the trends, follow the craze, and see the inspiration of throwing the run shoes away and maybe putting on something like a Vibram that will protect the foot from cuts and grazes and the terrain that they run on, but offers no other protection. If it's not done in a very, very slow and gradual way, then injury is almost certainly guaranteed.
100%. And a lot's been claimed about energy consumption and speed and et cetera, and none of the research to date has really supported it. If anything, it's disputed it. But there are people that run barefoot and they run very successfully with it. So it's not that there is one style that's right and one that's wrong. There may be an optimum style for each individual person. And if you have a look at a lot of elite runners, actually, as they get toward the end of races and stuff, they almost revert back to a heel strike, because when fatigue kicks in and at certain speeds, you tend to go back to natural form. The interesting thing is that the kind of minimalist, which is the next stage, which says, okay, now we're going to have a much lighter shoe, but it's not going to be no support, really started off with the Nike Free.
Yeah.
And they were aware that the athletes, a percentage of athletes trained barefoot to optimize strength and function of the foot, but then wore a shoe. And what they did was they looked at the loading pattern, the pressures beneath the foot when people ran barefoot. And then they compared that to a traditional running shoe, and then designed the Nike Free. So if you ever see the last of the Nike Free, it's quite a cool last, actually, because it's very mobile. It moves in different directions. And they were able to demonstrate with pressure analysis that they could mimic the barefoot running style closer than a normal shoe. And they actually, to their credit, did some research that looked at using the Nike Free as part of a training program. So when they designed it, it was never designed for total use. It was a part of a training program. And we're able to demonstrate an increase in range of motion in the joints at the base of the toes, and actually some muscle strength increase. So it certainly seemed as though that would be a sensible process. And of course, when barefoot kicks in, then you get the balance between them. You get the minimalist shoe, which is a fairly low, flat shoe, and then varying increments of heel height, so that you can still run heel-toe or mid-foot striking and get some support and protection, but you have a much lighter shoe. I think it's fair to say there's still a lot of controversy about what the right type of shoe is and how you advise someone which shoe they should use to wear. There was an interesting paper in the British Journal of Sports Medicine that they reviewed all the literature on the way that people were advised what type of running shoe they should use. And the question was, is your running shoe advice evidence-based? And effectively, there is no scientific evidence available at the moment that really guides the way that we advise people what shoe they have to wear. So a lot is done on some fairly traditional concepts about foot function and how it should work, and then a little bit of trial and error. What's been really interesting for me is something that we've introduced into our practice in the last 6 months is using 3D gait analysis. And the best way to describe it is, have you ever seen them animate people in Hollywood, and they put all the little markers on and they track them with infrared cameras?
Yeah.
Well, that's a 3D camera system. And that sort of facility is available in research labs traditionally. But the University of Calgary developed a system where you can use 3 of those types of cameras and then use trackers from the pelvis down to the foot and measure things that you can't traditionally measure on video analysis. So now you can measure how much the hip rotates, how much it drops, how much the pelvis drops, the knee rotates, and the amount of pronation, speed of pronation, time of pronation. The neat thing that they did was develop a software package that, instead of it taking an hour to do the analysis, does it in about 90 seconds.
Wow.
But more importantly, compares your data to a database of 800 other runners. So now you can say, right, compared to 800 other people, looking at a normal distribution, your pronation is in an ideal range, it's reduced or it's excessive. And they have some criteria they use to help then advise what type of running shoe you should use. And therefore, arguing that if when you're actually running, the amount of pronation, the amount of movement of pronation you have whilst you're running is low, you don't need to have a motion control shoe. You don't need to have a stability shoe. You actually need to have a lighter shoe because the problem's coming from somewhere else and you address where it's coming from. Now, it's a completely different way of thinking.
Yeah.
And we would never be able to do that until recently. They've now made it into something we can put into clinic and use. And I'm seeing some very interesting findings with that. There are instances where I would traditionally recommend more support. And in fact, on some patients that have done well with me that have had more support, yet the data suggests they don't need it. And I think the reason for that is that sometimes we get the benefit of the support provided because it's sort of helping to control a symptom, but it's not actually dealing with the cause of that dysfunction. So I'll go back to the analogy of saying, well, in this particular instance, you may see someone that actually doesn't pronate that much dynamically. They've benefited from it, but it's because they've got poor hip rotation. It's rotating too much, which is the driver, which is causing some symptoms further down. You can help those symptoms by controlling the foot, and they're okay for a while until they develop the next problem because the underlying cause has not been dealt with.
Right, okay.
And that is just opening up a whole new way of approaching things. It's fascinating.
Yeah. So I guess ultimately the crux of this is that if it ain't broke, don't try and fix it. You know, if you're running efficiently, you're running injury free, you're running pain free, then the chances are you've actually got the right shoe for yourself, and it's only should problems arise that there's a time and an opportunity to see somebody like yourself and seek a solution.
I'm going to say yes and no to that. And the reason why I'm going to say that is, yes, if you're running at a good level and you're running regularly and you're doing your right exercise program and balance, the chances are you're not doing too much wrong. However, we constantly see when someone comes to see me at 35 and says, well, how come I get it now? I didn't get it when I was 25, or they might be 45. There's lots of reasons why they may develop dysfunction during the course of life, but if you have a little inherent imbalance, whilst you're young and fit, you may be able to control that well. But over a period of time, your ability to control that or your endurance may change such that becomes a problem. Therefore, we're getting closer to a stage where we can say to someone, look, now because we can objectively measure what your function is, we can tell you if you have much of an injury risk, right, and where those problems may arise, and therefore you could put some strategies in now to optimize your function and reduce that risk. And so I think it very much depends on where someone is in their running experience and in their career. And the next interesting thing for us is fatigue function.
Yeah.
So we talk about people, you go down to the running shoe store and you've just come in from work and you have a little run on the treadmill. Well, but now when you go out and you do a 14-miler, at the end of that, have you got the strength to control your function at the end of 14 miles? Because we definitely see some people, if they go past the distance, they get injuries. Right? So the how far you can run is very much down to individual makeup, but also individual conditioning. So, yes, if you're doing pretty well, you're probably okay, but you never quite know what's underneath there. But certainly if you develop any injury, then definitely get it checked out.
So if I look at that from an objective point of view, are you saying that it would always be advisable, maybe before you started running or very early on in your running life, to have a health check to make sure that the shoes that you have, that the running technique you have are all good to stop problems arising in the future?
I'd definitely say that. I mean, that health check will be about checking out your shoes, your running style, your strength, your flexibility, the way you're able to control your pelvic, your hip motion. I mean, for instance, when I'm driving in my car, I look at people and I often want to stop and say, you really ought to go and see someone because you've got an injury waiting to happen.
Yeah.
I mean, that really came home to me a number of years ago. I was lucky enough to get invited to be involved in the Hood to Coast Run, which is something Nike organised out in the States, and it's effectively a 195-mile relay race, and there were like 10,000 runners in it. And just looking at all the different running styles just makes you realise why people are prone to injury.
Yeah.
And I think if you're deciding that you want to embark on, running regularly, doing 10Ks, half marathons, having a check-up early on is well worth the while, because that could avoid a lot of problems.
Okay, so we've looked at a couple of big issues regarding the foot. But a lot of people, it's the small issues, the small niggly things that cause them problems. Things like blisters, problematic toenails, athlete's foot, bunions, corns. I mean, the list really does go on. So if it's possible, in a nutshell, how should a runner look after his feet or her feet and make sure that they provide problem-free running?
Okay, I would say the single biggest thing with a range of those conditions you've mentioned is to make sure, irrespective of the style of shoe, that it fits. And for a shoe to fit properly, it needs to be foot shaped, which fortunately most running shoes are. And it needs to be 1 centimetre longer than the longest toe. Now, we did a study at Homerton, and 90% of our patients and 90% of our volunteers were in the wrong size shoes. And the vast majority are too short. And that is one of the single biggest things that I see, especially with ladies, because they're used to wearing slip-on shoes. That becomes their shoe size, et cetera, et cetera. So you put your shoes on, you feel where the end of your toe is when you're stood up, and you should have about the width of an index finger between the end of your toe and end of your shoe. And if your second toe is longer, it's at the end of your second toe.
Yeah.
Once you've got that length, you then need to make sure that the volume of the shoe is correct. And what that really boils down to is the width of the shoe. So if you've got the shoe the right length and you do the laces up and you're slopping around in them, what a lot of people do is come down in size. But now the shoe's too short, it's the right width. You need to get the shoe that length and volume-wise is best for your foot. The narrower and longer your foot is, the harder that is to do.
Yeah.
And the wider and shorter your foot is, the harder it is to do. But there should be 5 width fittings for every shoe size, but there aren't, because it's too expensive for the running shoe companies to do it. But spending a bit of time on that will save lots of problems, especially with blisters, because you're going to cut down friction and rubbing. Nail problems, if people have toenails that regularly go black and fall off, they really want to look at the length of the shoes. If you're getting corns and calluses, obviously that will help cut that down. One of the things you can do if you are prone to blisters is wear 2 pairs of socks instead of 1, and have a thin cotton pair right next to the skin, because that cuts down some of the friction. There are some nicer socks now that are available that help cut down friction as well. If you're prone to sweaty feet, athlete's foot, that type of stuff, then often that's a moisture problem. So if you've got 1 pair of trainers that you use all the time and you're using them every day, the chances are you're putting a damp pair of shoes on. Certainly look at your everyday shoes. If you wear the same pair of shoes every day, the natural sweat that you give off cannot dry out overnight, so you're effectively putting a damp shoe on, which is great for fungus that's on our skin, hence athlete's foot. So alternating your shoes every day can make a big difference. If you do have very moist, soggy skin, well, being very careful with your bathing, your hygiene, using surgical spirit, for instance, to help dry it out can be a help. Or if it's very dry, using an emollient to keep it soft and supple. So some very, very simple, basic things can make a massive difference to people. But the single biggest thing for me, what are the 2 most common things I have to advise my patients, is shoes that are correct for them and correct size, and calf flexibility.
Yeah.
They're the 2 single most common things that I have to advise.
And actually, it's perfectly logical, isn't it? Everything that you've said there just makes sense, but we see so many people who are making the same mistakes. I'd like to take that 1 step further, if I may. And there's certain races that are on the calendar, and I'm going to pick on the Marathon des Sables, which gives a particular type of test for feet. We've seen the photographs, we've heard the horror stories of people losing skin, toes, Does that ultimately come down to the fact that they went to that race with the wrong shoe? Because a lot of advice is given that because of the heat and because of the fact that it's a long race, that feet will swell, that they should go a size bigger. Would you agree with that?
That's a great question. And as far as I can see, that we haven't really seen any research that's been done around people as they competed. But interestingly enough, a few years ago, I had a couple of patients actually preparing for it. I did a bit of sponsorship for one of them, so we did some work with him. And we spent quite a bit of time around just trying to get him some basic support that wouldn't be too hot, looking at the size of shoes, and he spent a lot of time preparing, but still got a lot of swelling and got a lot of blistering. And I think I can't tell you, yes, the feet swell, because I've never been out at the end of the marathon. I've never seen any stats that have done a measurement before to a measurement afterwards. But to my mind, it just has to be a pure heat and friction type problem. Blisters occur because of friction.
Yep.
And therefore, if there's high friction, you're more likely to get a blister. And if you're running in sand and you get sand inside the shoes, you're going to get more friction. Now, it's quite possible that if the foot's swelling significantly, you're going to have that dilemma of when you're running at one point, this size shoe fits, but at another point, you need a different size shoe. And I would imagine the ultimate thing to do is be able to change your shoes after 5 miles, 10 miles, whatever it happens to be. The practicalities of that are somewhat more difficult, and therefore I think people have to try and get as close as they can to a sort of in-between size. Now, the other thing, and this particular patient, from recollection, I'm not sure he did, but you could consider extra socks, of course, to start with, because if your foot starts to swell, you could, in theory, stop to take a pair of socks off. Now, if you're serious about your running, you don't want to be stopping and doing things like that, because the time's going to be part of the importance for you. But certainly, I think it does make sense to have the larger size shoe, but you have to be careful. If it's too large, you'll get more friction, so you get more blisters. But the heat and the sand will be a contributing factor to those blisters.
Yep, makes perfect sense, everything that you've said there. And of course, I think ultimately these types of things are the scenarios that you have to try and use in training, find out what works, find out what doesn't work. And I guess, unfortunately, for most people who go to the Marathon des Sables, irrespective of what they've done in training, it's never quite the same as when it's in the race. Situations change, the environment changes, and I guess you need a process that you can adapt during that event. One thing that many runners do is they try and harden their feet up, and they use products like Tough Foot. I don't know if that's something that you've come across, but it's basically a cream and embrocation that you rub into the foot that hardens the skin up. Is there any benefits to that?
I mean, the skin is a fantastic adaptable organ. Yeah, if you do something on a regular basis, it will adapt to the shear and the stresses that you place on it. So if you're having to toughen it up, why are you having to do that? Has something changed so quickly that you need to toughen it up? There could be some logic in it if you're getting an area that's particularly prone to stress. But one would expect, a very simple example of that is that the best way of using a pair of scissors is to use your thumb and fourth finger. Okay, it gives you much more mechanical advantage. And as podiatrists, because we do a lot of work with scissors, that's the way we're trained to use them. And when I used to use scissors a lot more, I had a big area of callus right where the scissors would be. Over a period of time when I've done less, it's gone away again. And that's how the body adapts to stresses and strains. So I would say that if you have a good training program, then things should adapt accordingly for it. So we will see, tribes in Africa who run barefoot and their skin adapt for it. And over a period of generations, it becomes naturally thicker.
Yeah.
But it will also thicken up according to the stresses. So having to do that, I think, would only be relevant if you've maybe got some kind of condition that means your skin's less adaptable. But if your training program's adequate, then it should be fine. And I suspect that most of the products out there that people use aren't actually going to do them any harm, but whether it's doing them any good, well, you know, it's probably 6 of one, half a dozen of the other.
Yeah. Now, we could go on and talk about the foot literally for hours, but to wind this up, are there any pearls of wisdom that you can give to everybody out there, other than what we've already said, that are great takeaways that they can apply to their everyday running, everyday foot care?
Well, we've actually covered most of the common things, and I think, and it came about when you asked about the other marathon. There's one thing I sort of apply to myself, and it doesn't apply just to the foot. If you are out running and exercising, because of our everyday lives, things vary from day to day. And the body is excellent at warning us that it's not happy about something and that something may go wrong. So, for instance, when someone develops a blister, they don't just suddenly develop a blister. They start to feel some rubbing, some pressure, some irritation. One of the biggest precursors to a muscle strain, a muscle tear, is tightening of the muscle. Therefore, listen to your body. Just because you've done that run before, just because you've only just slowly increased your activity and you've not had a problem, today you feel your calf tightening or your arch rubbing or whatever. Listen to it and ease off. I went for a run at Christmas, and I know exactly why the problem happened. I didn't do a proper warm-up, and during my run I could feel my calf tighten. So I stopped, I stretched, walked a bit, ran a bit, just realised it wasn't going to be, this wasn't for me that day. So I walked home. My calf flared up so badly, even though I'd walked home, I had to go and have treatment on it, and it probably took 2 weeks to settle down. And I know that if I'd carried on running, I'd have had a significant injury that may have taken several months. So listen to your body. And if it means sometimes you have to stop what you're doing for that day, it means you won't miss it for weeks.
Perfect. That's a great way to finish off on feet and looking after them. Listen to your body. Look for the warning signs, and when the alarm bells start to ring, the best thing to do is stop, turn round and go home. Trevor, it's been a great pleasure having you on the show, and thank you for giving us some pearls of advice. I'm sure that in a future show we'll end up coming back to you and maybe talking and speaking about some different aspects.
My pleasure, and thanks for inviting me on.